doing the rest of our head, eyes, ears, nose, and throat assessment. I've already done part of that with my cranial nerves, but I will repeat part of that, except for like the snap test and things like that. But so with the head, eyes, ears, nose, and throat, I'm going to begin by actually inspecting the skull. So when I'm looking at the head, I do want to know, like, is it symmetrical? I don't know any major masses or indentations. I want to look at her hair condition. So I'm looking for hair growth or distribution. So I don't know any thicker patches of hair or thinning of the hair in places that I would not expect. I also want to note texture. So is it appropriate for ethnicity? Is the texture of the hair the same throughout, or do I have like an area of coarse hair or very fine hair that could indicate some issues with the scalp or even things like cancer? So if we do have things like male pattern baldness, those are kind of some expected abnormals that we can see with our patients. I'm not necessarily going to make a big production of that. I also want to check out her hygiene. So does her hair appear clean? Has it been washed, brushed? Is it matted, tangled, things like that? So her hair is appropriate for ethnicity. It is evenly distributed. I'm going to palpate her skull. And I don't feel any masses or indentations. Did you have any tenderness when I was palpating?
No.
Okay. I also want to look at her scalp condition. So again, I'm looking for lesions, masses, differences in skin coloration. And so you kind of do want to part the hair just throughout. Okay, so scalp is in good condition, no flakiness, dryness. I also don't note any type of infestations like lice, bed bugs, anything like that. Next, I'm going to go down to the eyes. So with my cranial nerves, I assess pupillary reaction. So if you're not specifically doing cranial nerves, you would definitely include that in this part. So I want to look at my patient. I want her gaze to be midline, or I don't want to note any type of deviations with the way she is looking at me. Both eyes should be pointing in the same direction. And I want to look at her pupils. They are round and they are equal to each other. I'm going to measure them in millimeters. And I would say she's at about a 3 millimeter. When she's blinking, both eyelids are blinking, lowering, and coming back up at the same time, so there's no lid lag. I want my patient to look straight at me. Just look at my nose. I'm going to shine my light just briefly. And I'm noting a reaction on both sides. Okay, and both pupils also react equally to each other. They constricted from about a 3 millimeter down to a 2 millimeter. Next, I'm going to check accommodation. So I'm looking for pupillary dilation when she looks further away, and then pupillary constriction when I get an object close to her face. So if you can look at the opposite wall over there. Again, I'm going to look at pupil size. When I bring my pen light into your field of vision, just start following it. Okay, and she did have pupillary constriction when she started to focus on the object. Next, I'm going to do my cardinal fields of vision. So I'm going to have her look at the tip of my pen light. I want you to follow the tip of my pen just with your eyes, not with your head. And again, I'm looking for symmetry of the eyes. I want to make sure that they are tracking together, which means they are moving together and there's no lagging and no deviations. And I'm also looking for any nystagmus, which is kind of a twitching of the eyes when they're tracking objects. So her gaze is midline. She tracks appropriately. I did not note any lid lag, no deviations, and no nystagmus. Next, I'm going to look at her ears. So I'm not going to do the cranial nerve test where I do the snap test. I am going to inspect the skin around her ears and also inside of the ears. So I'm looking for any lesions or skin breakdown, which I do not note. I am going to lightly palpate around her ears. Sorry, my hands are cold. Any tenderness?
No.
Okay. And inside the ear, I do not note any skin breakdown. She does have some piercings, but they are well healed. I don't know any type of signs of infection like redness or drainage. I did not note any drainage inside of the ear canal and no excessive earwax. And then I'm going to come to the other side and do the same thing. All right, so again, I'm inspecting the skin around the ears. and also inside of the ears. I don't note any redness or any lesions. I am going to palpate. Okay, I don't feel any lesions or masses. Did you have any tenderness when I palpated?
No.
No. Again, she does have some piercings, but they are well healed. I did not note any type of drainage or excessive earwax inside the ear canal. And then next, I'm going to do the nose. So I want my patient to, again, look at me straight on. I'm assessing her septum, which is this piece of cartilage right here. It does appear midline from the outside. Have you ever been told that you have any septal deviations or polyps?
No.
Okay. So I do want to look inside of her nostrils. And if you can lean your head back for me. I'm looking for any lesions, polyps, and then any septal deviations, which I do not see. I'm not noting any exudate and no drainage. It is a mucous membrane, so it is pink and moist. With the cranial nerves, you do want to assess for patency of the nair. So if you can, just plug one of your nostrils and take a deep breath in. Okay, and the other side. Okay, very good. So I noted clear airflow. I didn't hear anything like that would make me think that she is congested. I did forget mucous membranes of the eyes. So with that, I want to have my patient look upward. I'm going to gently pull down on her lower lids. And I'm inspecting the conjunctiva. They should be pink and moist, which they are. There should be no excessive dryness, tearing, or any type of drainage from the tear ducts. I'm also looking at the white part around her iris to make sure that it is white. I don't know any hemorrhaging or irritation or inflammation, and no yellowing of the sclera, which I don't see. Next, I'm going to assess the mouth. So I want to look at externally her lips. Skin is clean, dry, and intact. I don't note any lesions, dryness, or cracking. Can you open your mouth for me and say ah?
Ah.
Okay, so I'm looking at the uvula in the back of the throat. It should be midline. When she says ah, it should rise and fall with no deviations. I'm looking at the back of the throat for any type of exudate or drainage, and then also at her tonsils. Her tonsils are about a 2+, no inflammation, no exudate. And I also looked at the condition of her teeth. So she does have her own teeth. There are no missing teeth, broken teeth. I did not note any dental caries. It does appear as if she has appropriate hygiene, so she does brush her teeth. I'm also looking at the mucous membranes in the oral mucosa. They are pink and moist as well. I did not see any lesions on the tongue, her gum line, or her cheeks. And next is going to be the throat. So I've already assessed the back of the throat or her pharynx. I also do want to look at her external neck. So I should see her trachea here, which should be midline. I don't want to see any kind of bulges, no deviations. The neck should appear symmetrical. And then also I'm going to palpate for her thyroid just very lightly. And I can palpate the thyroid. It does not appear to be enlarged. Is there any tenderness when I was palpating?
No.
Okay. And I didn't know any types of bulges or masses or nodules when I was palpating. And that is it for head, eyes, ears, nose, and throat.